What about in terms of prevention? Of course, we can't prevent getting old, but what, as a healthcare practitioner, do you promote for patients to become just more cognizant and aware of how they should move forward health-wise?
That's a really good question. So prevention becomes very important in the older population. And I think we are lucky in that we have a lot of research that's helping us understand the best ways to help support our elderly clients or elderly patients for them to stay home as long as possible. So when I see a patient, my objective is to keep them as independent as I can for as long as I can. And prevention is probably the biggest part of that. So something that doesn't change across the lifespan is vaccines. So we make sure our patients are vaccinated and that their vaccines are up to date and that they have all the most current information in terms of the benefits of vaccinating. The second thing is promoting a healthy lifestyle. So as I mentioned earlier, smoking, alcohol, drugs, we want to reduce those as much as we can. And then we offer them any methods that we can to help them cut that stuff out. Third is optimizing their medication. So the older the patients are getting, a very common problem is polypharmacy.
Oh, yes.
Right? Mm-hmm. So the use of multiple medications that may or may not be treating the person's current health status. So we look at the list of medications and we decide, is this treating what it was intended to treat? So often because of accessibility, some elderly patients will be seeing lots of different healthcare providers, either in hospital or in clinic, or they'll be seeing different specialists who will prescribe medications based on the history that they've received, right?
Exactly.
So they end up getting either redundant medications or medications when combined together can lead to higher chances of side effects. So we look at the list of medications and then we see if we could trim out whatever that we can. And then we spoke briefly about lifestyle. Let me go back to that. We need to address things like diet and exercise. Mm-hmm. So remaining active is extremely important. So recommending low-impact exercises that the elderly population can both easily access and they can do to sort of stay fit and healthy. And then, of course, promoting a healthy diet, less meat, less prepared foods, less cholesterol. In terms of medical management, in prevention, what's important is screening tests. So up to a certain age, there are lots of screening tests that we continue to promote, things like mammography, not necessarily colonoscopies, but screening for blood in the stool, mm-hmm. Bone density tests, and pap smears up to a certain age. And then finally, certain medications that we give to just about everybody to help protect their bones, things like vitamin D and calcium.
Okay. So Greg, one of the biggest areas of interest for me is the role of the family. And as you know, I have aging parents. I have a dad who's 92 and a mom that's 90. And it's quite intense at this point because they really do rely on their children for help at home, help getting them to their doctor's visits, and so on. And it's quite interesting because I realize that when a young woman becomes pregnant and she's entering this new phase in her life, she'll read up and research, all about pregnancy and gestation periods and so on. And we prepare for this big moment. And yet, here I am, faced with this responsibility to look after my parents. And I'm just kind of going day to day, not really clear on the direction this will take. It didn't even hit me.
Sure.
What can you tell families, or what do you see, first of all, in our communities? Do you see family involvement?
That's such a great question. So one of my biggest objectives is to really promote family-oriented approach to care. Okay, so you would allude a little bit to the position you're kind of in terms of caring for your parents. So you're sort of what we affectionately refer to in a lot of literature is the sandwich generation, where you're sort of sandwiched between the pressures of caring for your children and caring for your career, and then caring for your parents, right? And that involves a lot of pressure, and where you're pulled in a lot of directions, and maybe it's often very directionless, and it can be difficult to navigate in our sort of mysterious healthcare system, where it's not always clear where we get the best resources. So not only am I caring for those elderly patients that we see, which I see in my office, it's important to address care needs of the person who is accompanying them, who, again, the better we get at optimizing care, I'm seeing elderly patients taking care of their elderly parents. So you'll have a patient who's 65, maybe 70, taking care of their 90-something-year-old patients. It happens. And then we need to sort of best care for the entire family, and not just the person who's sitting in front of us. So family-centric care is extremely important to me in terms of managing a case or a situation.
And do you feel that families or the children of the elderly are equipped? Do they have the right information out there? Because it's kind of all over the place. Wouldn't you agree?
I would. I think it's even difficult for me often to get the information that I need to see, what services can I provide this person in front of me? And not only what services can I provide for this elderly client, what services can I provide for their family in terms of support or psychological support, financial support, which can be very draining on the entire family. How do they access information? So yeah, it can be very complicated. And I think you had mentioned that this is not something we necessarily prepare for. You're kind of thrown into it. We're kind of thrown into it. And in a lot of ways, it is kind of like having a baby. I mean, there's never a good time, right? There's never a good time for your parents to get old. And then we just sort of need to learn by doing.
Right.
Which means often we get led onto the wrong path, or often we don't have the correct information. Often we feel lost. Often we get frustrated, which makes it important to have somebody who's really, which makes primary caregivers so important in terms of knowing which resources to access, and then knowing the family members, and knowing not only what resources are available to them sort of externally in terms of money and homes and the ability to get around, but what sources they have internally, their ability to cope. Can I cope with my parent getting older? Can I cope with all these added pressures? So that's what makes primary caregivers in terms of caring for the elderly very important.
Now, what would you recommend for, say, an elderly couple who really do not want to leave their home? They're really resisting the idea of either moving in with one of their kids or going into an old folks' home.
What would I say to them?
How would you deal with this? I mean, obviously you've got these people who are entrenched in their ways. They don't like change, especially at that age. But it's more and more difficult for them to remain in their own home.
I think, very generally speaking, there are probably two approaches I have, depending on the person's situation and what support they have around them. So generally, the first thing I say is, good for you. I want you to stay home as long as possible too. And that begins to involve a bit of a complex assessment where I may not necessarily be able to do on my own. Okay, so I can assess the person's medication, their memory, their balance, their current health status, and I can maybe objectively decide that this person is okay to stay home. But that doesn't give me a lot of information in terms of how they're actually doing at home. So then we have to sort of bring in external resources. So here in Quebec, we're very lucky in that the CLSC can send an occupational therapist, a nurse, a physiotherapist to a person's home to sort of assess what is going on, and then again provide even more resources for that people to stay. They can help adapt the home. They can provide tricks. They can provide physiotherapy at home. They could provide a part-time caregiver that can come and help that person with any needs that they may have. So I think in terms of primary care, most of us, our objective is to keep them at home. So that's sort of the first approach. The second approach is when we sort of get to that critical point where this is dangerous. Like we need to do something to make sure that this person stays as safe and as long as possible. And I think that's what you're referring to. Is that sort of that patient or that person who was saying, don't tell me what to do. This is my home. I will stay in my home. I've been here for 50 years. Something I hear at least 3-4 times a week, probably.
Okay.
I think the most important thing is to try to understand where is the anxiety coming from? Where is the anxiety about change coming from? Is it that they just don't like change? Well, then that we can probably work with, right? We can sort of gradually build up the idea of them leaving. So gradually increasing the amount of care that they get at home, and then and gradually every time we see that person, sort of reassessing where they at in terms of thinking where they want to be or how safe they are at home. One strategy that we can use is, I mean, it's unfortunate, but if there's some kind of accident at home, a fall, for example, or somebody forgets to take their medication, or there was a minor car accident, and hopefully that's all that it is, we can sort of use that as an exemplar of maybe this is a good opportunity for you to look into assisted living. Not necessarily a home, a residence, a hospital, but assisted living. That's sort of the second thing that we need to do, is kind of address how much care do they need. Can they go into, first of all, can they afford to go into a private care facility where maybe they just have some additional help? Maybe there is an orderly on the floor who can just help them with cleaning and getting around and doing dishes. Or maybe there is a nurse who comes in once a week that can help them with any medical needs. There are lots of sort of buildings and residences that provide that type of service. I mean, the issue is they can be very expensive. Some patients need much more involved care, like there's some kind of an acute injury. There's a fall where they break a hip and then they decompensate and they have a hard time recovering from that injury. Then often from hospital, they can be, I shouldn't say often, but from hospital, they could be put directly into a provincially run residence where they can get more hands-on acute care. So I think assessing what type of care that they need is extremely important. I always try to explore what resources the family has to help that person as well. So I think you had mentioned something like the parent is unwilling to move in with the child or with the child and the person. But what we also need to consider is that child ready to have the parent in the home, because it involves this tremendous change in terms of lifestyle and maybe adapting their home or maybe displacing a lot of the things that they're used to. So what I try to do is integrate the family as much as possible, but we need to see that everybody is open to doing that, which kind of becomes a big part of the process as well. Because not only is this elderly person going to lose their independence or sort of lose what they're used to, we're potentially turning the child's life completely upside down in terms of caring for that person or in terms of reorienting the routine. So we sort of need to assess whether the whole family is ready for that as well.
Well, let's stay on that point. Do you think that the family ties are strong here in Quebec?
That is a difficult question to answer, because there's no doubt that is one of the things that is very culturally bound. So there are some cultures who strongly feel that my duty is to take care of my parents, whether I want to or not. It makes very little difference. They're moving in with me. I will turn my house upside down. Because that's just what they need to do. So there are some cultures that really kind of embrace multi-generational style of living where there are lots of generations living under one home or under one roof and everybody's sort of cared for equally. There are other, I don't want to say cultures, but there are other types of people. I guess the more independent that we get and the more we move into the 21st century, the more we sort of want our independence and the more we appreciate our independence. And there are lots of families, and I don't necessarily blame them, who say, I don't want the parent in my house.
Right.
I will help them get whatever they need. I will visit them. I will pay for them to have a caregiver. I will look for homes with them, but I don't want them in my home. In terms of numbers, I'm not sure that I could address. I don't know. I think it depends on which community you live in, what cultures you're seeing the most frequently, how affluent the community is. There's no question. The richer the family, the more likely they are to be in a private residence versus in a person's home. So I think financial means is one of those things that's very important in terms of answering that question. So I'm happy to say that lots of families stay very involved. So most of my elderly patients, maybe about half of my elderly patients will come in with a family member.
I use my parents as a reference point because I do see them regularly and they share their feelings with me. But I imagine it must be very difficult once you reach a certain age. All your friends are kind of slowly dying. And the children have their own busy lives. What can you say about that? Is there something we're missing in our approach to lifestyle and so on? What can you say about isolation and the elderly? Do they go hand in hand?
That's an interesting question. And do they go hand in hand? I don't know that is a problem we can say is specifically a problem of the elderly. They're probably more prone to it, but I think the person's personality has a lot to do with it. There are lots of resources within the community, free activities that they can participate in. They just need to be willing to do that. And a lot of that becomes a mix of personality, ability to get out of the house, and health status. But the resources are there. There are also things like daycares for the elderly that we're seeing. I've seen some really exciting programs in the U.S. actually where they're combining daycares for kids and integrating the elderly into those daycares where they're sort of having kids and elderly play together and keep each other busy and sort of interact with each other, which kind of increases the happiness level of everybody. So there are exciting programs out there, and there are lots of things that we can do to reduce isolation. But for sure, the elderly are more prone to be isolated than, say, you and I are, again, because of health status and accessibility and maybe money or the ability to drive or to get out of the home. It's an important problem. And when it's something I talk about I speak about to my patients frequently, and when I do, we look at strategies to reduce that isolation. And then I think my most isolated patients are probably the case that you spoke about earlier. That person was at home, and they're probably widowed at this point, and they're saying, I don't want to move. Like, this is my home. I was born and raised there. I'm not leaving. And those are probably the people who are most isolated. They have their neighbors that they can speak to, but often they are in homes where most of their time is spent, if they're able, to care for that home. They still need to cut the grass, they still need to do the laundry, they still need to do their dishes, which reduces the amount of time that they have because it can take them longer to accomplish a lot of tasks. That reduces the amount of time that they have to spend with others. So those types of patients can be very isolated, and those are the types of patients where I start to talk about things like a residence or things like assisted living. I'll say, wouldn't you appreciate meeting other people of your age who are probably in similar situations? And then it sort of opens up the appeal of assisted living, or it opens up the appeal of maybe leaving their home without giving the sense that you're trying to force this person out of their home. I never want to force a person out of their home, but I mean, isolation is one of those aspects that we could work on to sort of promote the idea that maybe you should give up this lifestyle that you're used to and go to a place that may be a little bit more safe. In terms of reducing isolation, I mean, we had spoken a bit about those resources, and I think if we go back to what I was speaking about earlier in terms of promoting a healthy lifestyle, that could be an important way to reduce isolation as well. So if I'm encouraging my elderly patients to stay active, I will ask them to join an exercise course, for example, something like Tai Chi, yoga, swimming, aqua fitness are all very low impact activities where they have the opportunity to interact with lots of other people in a similar situation. So it can be a little bit tricky in terms of finding ways to reduce that isolation. My most isolated patients are probably the ones that frighten me the most because I mean, you're absolutely right. They're on their own, and in the event that there is some kind of an injury, like one of the most common things that we're seeing is a fall, and they can't get up, or they can't reach the phone, or they don't have a neighbor who can hear them. And these are the types of patients that frighten me the most and who are most at risk of having an injury that they won't recover from.
So